Hi everyone, my name is Scott Westerman. Today I'll be presenting my evidence-based practice project focused on improving preventative care uptake in underserved adults. My goal is to show how structured preventative health education and accessible screening programs can significantly improve immunizations and screening behaviors among adults who often face barriers to care. This presentation walks through the practice problem, my PICO question, the search strategy, evidence synthesis, change model, evaluation plan, and the next steps for implementation and dissemination. Preventative care is one of the most powerful tools we have for reducing disease and improving long-term health, but many underserved adults don't receive it. People may struggle with transportation, cost, limited clinic hours, or simply not having enough information to make preventative choices. My project explores a structured approach that uses education and accessible screening options to address these gaps and promote health equity. This issue matters on multiple levels. For individuals, missed screenings and immunizations can lead to preventable diseases, delayed diagnosis, and reduced quality of life. For families, illness can mean financial stress, lost wages, and emotional strain. For the healthcare system, late-stage disease management becomes more expensive and resource-heavy. Evidence shows that when prevention is emphasized, outcomes improve and healthcare spending decreases. This makes preventative care both a clinical and ethical priority. My PICO question asks, in underserved adults, does implementing structured preventative health education and accessible screening programs compared to usual care with limited preventative emphasis increase immunization and screening uptake over 12 months? This question focuses on a realistic timeframe and measurable outcomes that show whether preventative care behaviors actually improve. To develop this project, I conducted a structured literature search through CINAHL, PubMed, Google Scholar, and the Cochrane Library. I used keywords like preventative health, screening uptake, community health worker, and education programs. After screening more than 60 articles, I selected studies that specifically examined structured education programs, community health worker interventions, and strategies that improve ease of screening access. These studies form the evidence base for this project. Across the literature, several themes stood out. Community health worker or CHW-led programs consistently improve vaccination uptake, screening rates, maternal health behaviors, and disease detection. Home-based screenings and digital tools improved accessibility and participation. Proactive outreach, meaning going to the patient rather than waiting for them to come to the clinic, was more effective than fixed site care. Overall, structured education and flexible screening programs produced reliable improvements across diverse settings. This table summarizes some of the strongest studies supporting this change. We see major improvements such as vaccination uptake increase from 44% to 76%, hypertension screening completion at nearly 90%, and hundreds of children identified for needed care through school-based screenings. These outcomes show consistent measurable benefits in structured education and CHW-led supported programs. This graph shows the expected improvement over 12 months. Screening uptake could increase from around 40% to 65%, and immunization uptake from around 50% to 75%. These changes reflect improvements seen in published studies, and they represent realistic goals for community clinics adopting structured education and outreach approaches. This project is designed for community clinics serving underserved adults, places where transportation barriers, limited health literacy, and inconsistent follow-up are common. These clinics often rely on community health workers, which makes them ideal for structured preventative education and flexible screening approaches such as home visits, evening clinics, or mobile screenings. I chose Cotter's 8-step change model to guide implementation because it clearly outlines how to build momentum, secure leadership buy-in, and sustain improvements. Steps like creating urgency, forming a coalition, communicating the vision, achieving quick wins, and anchoring change into organizational culture align well with preventative care initiatives. This model also fits my personal style of structured, stepwise change. To evaluate the intervention, I'll measure three main outcomes: immunization uptake, screening completion, and follow up attendance. I'll compare clinic records from the 12 months before implementation to the 12 months after. A paired t test will be used to analyze changes, or the Wilcoxon test if the data are not normally distributed. These methods align with evidence based evaluation practices for quality improvement projects. Data will come from electronic medical records, community health worker logs, and screening documentation. Patient confidentiality will be protected by using secure, password protected systems and removing identifiable information. Analysis will focus on whether preventative behavior is improved and whether changes were statistically significant. Continuous monitoring will help ensure sustained progress. Results will be shared with clinic leadership, community health worker teams, and community partners through presentations and written summaries. I also plan to use posters, infographics, and community health worker outreach materials to share findings with the community. At an academic level, this project could be presented at school events or conferences to demonstrate the impact of structured preventative care programs. In conclusion, underserved communities continue to face preventable health gaps, but structured education and accessible screening programs offer a strong evidence supported solution. This research clearly shows the effectiveness of community health worker led education, home based screenings, and proactive outreach. By implementing this project using Cotter's model and evaluating it with reliable methods, we can make meaningful improvements in preventative health outcomes. These references reflect all evidence used across the PICO, systematic appraisal, and evaluation planning sections.